born in Montreal, raised in Montreal, married in Montreal, and then in 1966, with 2 young daughters, we decided to move to Ottawa. We ended up buying a house in Nepean, and we stayed there for the next 30-some years in the ambit of the Queensway Carleton. We lived in Briar Green, and I was president of the Community Association for a few years there. Hank Muse is a close personal friend, and he was on the hospital board. He wanted to know if I would put my name up for the board, which I did, and so the next year I was made a member of the board and carried on from there on.
Gordon one day was out in Vancouver, I believe, on business, and I was on the board at the time, and we were wondering where we could get some new board members, and so I called him and I said, hey, it's time you became a community guy and joined the hospital, which he did, and the rest is history. He did a first-rate job.
I spent 9 years on the hospital board. We spent a lot of time to try to improve services and see how we could share responsibilities.
Gordon May was a wonderful board chair, a wonderful foundation member, and I certainly learned a lot from him and enjoyed my time working with him both on the foundation and the hospital board.
These were collective efforts. We had a very, very solid group of people on the board. I can't remember ever being part of a group that was so focused on doing the best they could individually and collectively for the hospital. It was a really synergistic arrangement between the medical staff, the hospital management staff, and the board. We were all working towards the same goal, and it was fun to be part of that.
Gordon served on the hospital foundation board long before I arrived. I approached Gordon after I had been with the foundation for a few years and invited him to come back and participate as a cabinet member, so an individual who would help introduce us to people who could support the Care Grows West campaign. And Gordon didn't hesitate.
Lois and I have had the good fortune of retaining some relationship with the people on the foundation so that we have participated in and been part of fundraising for the amazing expansion of the Queensway Carleton. Lois was diagnosed with breast cancer 2 years ago. She was operated on, had a mastectomy at the Queensway, and then had her post-operative treatment, primarily at the Greenberg Center. And I think it made us feel that anything that we had done to contribute to the growth of the Queensway and the addition of the Greenberg Center had been paid back to us. Huge, huge dividends. I mean, we could not have expected better treatment anywhere. When she was in for treatment, I would talk to different people who were coming from miles to have their treatment there. And here we were living in Canada and had this marvelous facility just down the street from us. I thought, what a great investment. All of the people who'd given their large and small donations, whether it was of money, of time, whatever, could really see the fruits of their investment in that facility.